Hi everyone, the topic we're going to be discussing and focusing on today is aging populations and the nursing profession. So a general overview of the topics we'll be discussing, we're going to start by exploring definitions of aging, identify the issues in healthcare and what the nursing role is in terms of healthy aging. We're going to continue by discussing professional standards and the therapeutic relationship, as well as ethics, aesthetic, and emancipatory ways of knowing, and discuss how the organizations, the CNO, RNAO, and CNA, all implement these standards and provide us with guidelines. And then we're going to finish off by giving some recommendations as well as some limitations that we're experiencing at the moment. So when we think about definitions of aging, we need to think about the perspective that we're coming from. The definition will change based on that perspective. So starting with a historical perspective, prior to the Industrial Revolution, older adults were considered valuable sources of knowledge. So they played influential roles in social, political, and religious circles. The Industrial Revolution shifted this view and was marked by modernization and a separation of the work and home. So we then shift to a biomedical approach today, where social thinking perpetuates the idea behind medicalization of the human body. So from this perspective, aging is viewed as a disease process, which is caused by physiological and biological decline in healthcare systems. Okay, from a political perspective, perspectives are going to focus on the relationships between power, knowledge, and the location of influence and how that influences the political agenda. So this is centered on disease management approach to care, which results in acute care processes. So we focus on acute care processes versus on continuous life changes, like we would consider in aging populations. So to date, the majority of healthcare dollars is still mostly spent on acute care and in the hospital sector. When we look at an economic perspective, we focus here on health expenditures and growth. We mostly take a look at the major drivers for uncontrollable healthcare costs. So we tend to put an individualistic approach in this sense. So from a neoliberalist approach, it places responsibility for health and aging on the individual. And then we also have a quote here from Kai Hai that basically tells us that although we think that the aging population is the major driver in terms of costs, that as a general, this isn't the case, that there are other factors that are actually major contributors to spending, which would be related to spending on pharmaceuticals and technological advances. Now, when we look at this from a feminist perspective, the feminist perspective focuses and makes connections that interrelate gender, the aging process, and their interactions with the healthcare system. Feminists say that aging is a woman's issue since women tend to outlive their male counterparts. So this is going to pose a significant issue since the majority of aging population will be female. Also, the approach problematizes the shift from institutional care settings to community care seniors, since women tend to be the ones that provide most of the informal caregiving. So like we mentioned previously, the definition of aging is going to be based on the perspective that we look at it from. But in general, we need to acknowledge the social construction of aging. So Western society has defined aging and old age based on categories of chronological age. Aging is often associated as a biological process with a series of losses, associated with a series of losses. So, for example, loss of viability, losses of function, independence, and power. However, aging is a relative term defined by the personal meaning one gives to it, so including how one feels, acts physically, emotionally, socially, and culturally. Okay, so I'm just gonna identify some of the major overarching issues that are being experienced as it relates to healthcare and the aging population. So the first one is sort of foundational. So ageism. Ageism is socially constructed way of thinking, but it's going to have real life implications that are evident both through individual biases, but also structurally within the healthcare system as a whole. it's going to be a very major barrier to the promotion and implementation of a healthy aging agenda. So, the second major issue is related to the fact that healthcare systems continue to be designed for cure, short term cure, and acute healthcare conditions. So, this is going to be contradictory to the needs of older populations where long term care services can better suit their ongoing needs within a community setting. This is especially the case with aging baby boomers, which is basically shifting our focus in the way that we should be delivering care. And the third major barrier is from an economic perspective, which questions the sustainability of the healthcare system. So here we exacerbate issues related to funding and resource allocation. We do have a lot of downsizing and cost cutting that's happening that's going to have major implications for healthcare providers and the nursing population, specifically in terms of how to provide appropriate care and safe care for the complex needs of the older populations. So, where does the nursing profession fit into all of this? Well, the nursing profession embraces holistic care, views the individual not only in terms of the physical, but also mental, social, and spiritual well being. Nurses enable patients to attain their highest possible level of health and well being through patient centered care. So, therefore, our position through all this is to support healthy aging and independence in seniors in order to achieve optimal health and the best quality of life possible, which in the long term will help to relieve pressures from the system, from the healthcare system as a whole. Okay, and on this side, we just have some questions that we'd like you to consider as we're going through the rest of our presentation.
So now we're going to explore how does the unique body of nursing knowledge form the basis for standards in nursing practice associated with aging population in nursing. So first we're going to look at professional knowledge. The goal when dealing with older populations is to establish professional standards and therapeutic relationships in order to promote optimal health. This can be done through proper accountability, leadership, knowledge, and competence as explained by the CNO professional standards. So the first professional standard is accountability. With neglect of elders on the rise, it is important that nurses are held accountable for their actions. Nurses will be taught and trained to identify and respond to individual needs. Next is continuing competence. The complex and diverse healthcare needs of older adults require nurses that are able to deliver knowledgeable, competent, and contemporary care. This can include risk determination and health promotion. Continuing education and development of competencies will remain vital links to improving geriatric nursing knowledge in the current and future nursing. And then the third one is ethics. Ethical protection becomes a principal concern when a group such as the elderly is identified as vulnerable. Knowledge application. We need to take in understanding and consideration of normal age-related physiological changes. This can involve assessing to distinguish the clinical presentations of delirium, dementia, and depression, the 3Ds, using validated and reliable screening tools, and involving the team in care planning and management. This could also mean implementing falls prevention protocols, employing a valid and reliable measure of fall risk assessment. Leadership, facilitating and recognizing the benefits of interpersonal care in linking older adults and their families to community organizations, policymakers, and the public to meet the needs and issues of growing aging population. And last but not least, we have professional relationships, communicating effectively, respectfully, and compassionately with older adults and their families. Next, we're going to look at personal knowledge through therapeutic nurse-client relationship. Gerontological nursing is a dynamic interaction between the client and nurse to achieve health and well-being. The client and the nurse both contribute to the interaction. Nurses collaborate with clients to promote well-being, optimize functional abilities, and act as advocates for clients. The first component of the therapeutic nurse-client relationship is the therapeutic relationship. So this means nurses use a wide range of effective communication strategies and interpersonal skills to establish and maintain nurse-client relationship. So within the aging population, it is important to note communicating effectively and respectively, as I mentioned before. using decision-making tool resources, communication strategies, and making appropriate referrals in order to provide counseling related to the needs and abilities of older adults and their complex decisions that arise with aging. And we need to facilitate communication between families and older adults transition between home, hospital, home care services, and nursing homes. The second component is client-centered care. Client-centered care involves advocacy, empowerment, and respect for clients' autonomy, voice, self-determination, and participation in decision-making. So within the aging population, it is important to assure participation of older adults and their families in decision-making. This could be in terms of advanced care planning, healthcare proxy, informed consent, or elder abuse reporting. It is also important to facilitate older adults' active participation in all aspects of their own health care. For example, access to information, right to self-determination, right to live at risk, access to information, and privacy. The third component is maintaining boundaries. Ways in which roles and relationships are constructed, negotiated, and experienced by nurses and elderly people is extremely important and illuminates the centrality of relationships between nurses and the aging population in defining the experiences and perceptions of both groups and quality of care overall. Therefore, it is important to maintain professional boundaries with these patients to optimize their health. And the last component of the therapeutic nurse-client relationship is protecting the client from abuse. So in terms of the elderly, elder mistreatment is growing and a hidden problem. Nurses have a responsibility to identify any mistreatment or potential abuse. A nurse's role in the recognition and management of abuse includes assessment and screening, direct care, and complaint investigation, intervening to eliminate or minimize the use of physical, chemical, or environmental restraints will minimize injuries, using established criteria to identify elder abuse and follow standards of care to recognize and report any physical, financial, sexual, neglect, emotional, and social mistreatments.
What is the major role of ethical knowledge in older adult care? The ethical pattern of knowing in nursing requires an understanding of different philosophical positions regarding what is good, what ought to be desired, and what is right. Major areas of ethical knowledge application in older adult care are ethical values and responsibilities, ethical endeavors, and ethical dilemmas. Registered nursing practice in Ontario have two major ethical guidelines for our ethical knowledge application in older adult care. The major one is CNA Code of Ethics for registered nurses. This code promotes ethical knowledge application in patient care throughout the Canada. The second one is a practice standards of ethics developed by CNO. The code states that it's important for all nurses to work toward adhering to the ethical values at all times for persons receiving care, regardless of attributes such as age, gender, disability, and others. There are total 7 values, 4 of them the most relevant for older adult care. First, it's providing safe, compassionate, competent, and ethical care. The second one is promoting health and well-being. The third one, honoring the dignity. And the last one, promoting justice. By providing safe, compassionate, competent, and ethical care in older adults care, nurses need to question, intervene, report, and address unsafe, not compassionate, unethical, or incompetent practice or conditions that interfere with their ability to provide safe, compassionate, competent, and ethical care, and they support those who do the same. When resources are not available to provide appropriate or safe care, nurses collaborate with others to adjust priorities and minimize the harm. By promoting health and well-being in older adult care, nurses provide care directed first and foremost toward the health and well-being of persons receiving care, recognizing and using the values and principles of primary health care. Nurses collaborate with other healthcare providers and others to maximize their benefits the persons receiving care. And we know that collaboration is very important in all the adult care because it always requires a health team participation. By honoring dignity in all the adult care, nurses work with persons receiving care to take into account their values, customs, and spiritual beliefs, as well as the social and economic circumstances, without judgment or bias. As an example of bias is ageism. Nurses encourage persons receiving care at the end of their life to be clear about what they want. They listen to a person's stories and give greater clarity about their goals and wishes. In all practice settings where nurses are present, they work to relieve pain and suffering, including appropriate and effective symptoms management to allow persons receiving care to live and die in dignity. By promoting justice, nurses don't discriminate on the basis of person's age, health status, mental or physical ability, socioeconomic status, and any other attributes. Nurses make fair decisions about the location of resources and under their control based on the needs of persons receiving care. They advocate for fair treatment and fair distribution of resources. Ethical nursing practice addresses not only values, but a broad aspects of social justice that are associated with health and well-being. It's closely related with the concept of emancipatory knowing. So-called ethical endeavors in all the adult care are utilizing the principles of primary health care for the benefit of the public and persons receiving care. The next one is recognizing that vulnerable groups in society are systematically disadvantaged, which leads to diminished health and well-being, and advocating to promote their quality of life while taking actions to overcome barriers to healthcare. One more endeavors in maintaining awareness of major health concerns such as poverty, inadequate shelter, food insecurity, and violence, while working for social justice, individually and with others, and advocating for laws, policies, and procedures that bring about equity. And the last part of ethical knowledge application is the solving of ethical dilemmas. There are many of them in older adult care. Here are just some examples discussed in the literature. The one example is the difference of values between seniors and healthcare team and informal caregivers. The another one is a finding balance between promoting independence and autonomy for seniors by not interfering with their life goals, and on the other hand, trying to act responsibly and promote health and safety. One more dilemma is end-of-life care and the decision to treat against the wishes of dying person. For example, family members who persuade us to prolong or start treatment when it's expressly against the wishes of dying person. One more component of nursing knowledge is aesthetic knowledge. Aesthetic knowledge of nursing incorporates artistic and expressive component, like humor. It provides holistic approach to an adult care. It's very important because implementation does not require additional resources. On the other hand, nurses who provide such care need to be very professional and need to have some experience in that area.
In addition to the other four ways of knowing, a new type of knowledge was introduced, and it was known as emancipatory knowing. And this is the capacity not only to notice injustices in a social order, but also to critically examine why injustices seem not to be noticed, and to identify social and structural changes that are required to right social and institutional wrongs. This makes it possible to create social and structural change, and it also relates to nursing professional standards of leadership. Emancipatory knowing helps shift the focus of healthcare from treatment to disease prevention and health promotion. It helps dispel negative stereotypes of aging, such as ageism, and it promotes the concept of active aging. So, what is active aging? Who defines healthy aging as a process of developing and maintaining the functional ability that enables well being in older age? Functional ability includes both intrinsic capacities, such as mental and physical capacities, and environmental aspects.
Thus, healthy aging requires a reorientation of the healthcare system, which gives more attention to the promotion of health and the determinants of health. It also includes the need to be socially connected as one grows older in order to stay physically active and prevent falls and other risky behaviors. The advantages of active aging include reducing general costs of healthcare, improving the quality of life of older adults, and creating a positive image of older adults in society. So, how can nurses contribute to active aging? This can be done by working through professional organizations to renew emphasis on long term care, as well as collaborating with other professional groups to promote wellness for caregivers and those who provide care for older adults, and lastly, lobbying for recourses necessary to enact the vision of active aging.
How do various nursing organizations introduced in this course impact the chosen nursing practice association with aging population and nursing? The College of Nurses of Ontario. The CNO is the regulatory body of registered nurses, registered practical nurses, and nurse practitioners in Ontario. The college serves the public by ensuring the right of the public to competent nursing by maintaining self regulation in the profession of nursing. Regulation of nurses in Ontario is accomplished with reference to the Regulated Health Act of 1991 and the Nursing Act of 1991. There are four roles of the CNO, which are 1. Advocating the practice standards, 2. Providing the requirements for entry to practice, 3. Carrying out quality assurance program, and 4. Implementing the practice standards. The CNO and the aging population. The CNO provides standards of practice for registered nurses so that the utmost professionalism is maintained during a nurse-client relationship. The professional standard is a mandate which encompasses and connects all the standards provided by the CNO. The standard outlines specifics of how to maintain a therapeutic relationship with the patient, such as protecting them from possible abuse. According to the World Health Organization, elderly abuse is a common issue and unfortunately is on the rise due to longevity of life expectancy. Literature indicates that health related organizations, which would include governing bodies like the CNO, play a vital role in the prevention of abuse. Since the promotion of healthy aging and independence is the core of our thesis, the CNO's therapeutic nurse client relationship of 2006 dictates that nurses must ensure that the client's goals and needs are centric to the plan of care by demonstrating thorough understanding of the client's values and beliefs and making them an active team member in the overall care. The Registered Nurse Associations of Ontario. The RNAO is a professional organization that represents the registered nurses and students in the province of Ontario. RNAO is active in promoting political action in terms of public health and the nursing profession by being influential in decisions that are made about the practice of nursing. The values which RNAO uphold is stated on their website, which you can go read. RNAO and the aging population. RNAO has released many best practice guidelines that helps nurses ensure that the aging client maintains health and independence. One example of such guideline is prevention of falls and fall injuries in the older adult. The Public Health Agency of Canada has found that fall-related injuries affect more than 50% of the aging populations of Canada, which can lead to institutionalization, permanent disability, and even death. RNAO's goal within such circumstances is to reduce such accidents and encourage independence in any setting, such as the home or long-term care. The guideline is a toolkit for clinicians to screen for fall risks and appropriately intervene using the nursing process. It also enables the clinician to provide client education regarding risks and how to go about daily activities while understanding the dynamics of fall related injuries.
The Canadian Nurses Association is the national voice of registered nurses in Canada. The association believes that a national strategy on healthy aging is needed to address the various dimensions of care, such as long-term, home, and community care. A key factor in the development of these strategies is the central message that the amount of healthcare services seniors use is largely determined by the number of chronic conditions they have and not by their age. The CNA has proposed 3 strategies. The first one is promoting the health and well-being of Canadians as they age, which includes healthy and active aging, as well as volunteering and workforce participation. Secondly, access to supportive chronic disease prevention and management, which involves resources and support and community-based primary health care. And lastly, increasing awareness around frailty and vulnerability. And this involves implementing a national dementia strategy and integrating palliative care across the continuum. CNA's role for nurses involves addressing the burden of chronic disease by introducing a pan-Canadian healthy aging strategy to provide seniors with better healthcare and reduce the need for acute and ongoing care. This strategy would involve health promotion and early detection of disease in order to keep people in their homes for a longer period of time. This involves the use of interprofessional health teams where RNs could work with other professionals to emphasize healthy living and chronic disease management. Research shows collaborative teams have better results in improving chronic conditions as well as increasing the access to care.
Okay, so we're going to recap the main issues we discussed. First was ageism, second was the lack of healthy aging, and third, resources allocation. So now I will discuss some of the recommendations. The first is knowledge application. So it refers to nurses should apply their knowledge of gerontology to challenge the causes of ageism and address the issue on over-medicating the elder population. Medicalization is a major concern for the elderly population, and this can be prevented through investing in active, healthy aging programs. Second, shift in the healthcare policy focus. Care delivery and focus on the health promotion and disease prevention. Example, LIN program that educates elderly on the healthy aging that includes fall prevention program, healthy diet, and active daily activity programs. Third, nurses as activists. Collaboration with organizations, for example, Canadian Association of University of School of Nursing. Collaborating with the National School of Nursing gives nurses powers to advocate for changes in the nursing curriculum. For example, implementing courses on the elderly can help prepare nurses to provide age-appropriate services and helping to improve the elderly quality of life. The first recommendation will be nurses for lobbying for inequality on acute and long-term care. Nurses should advocate towards more funds for the long-term care. Focusing on long-term care will help the elderly that suffer from chronic illness to achieve a healthy aging because they are being provided with continuous care instead of an acute care. Fifth recommendation will be family care services. Nurses are recommended to teach family caregivers on promoting healthy aging and recognizing them as part of the healthcare team. By recognizing family as central to care will decrease the demand for informal caregiver. Those will be cost-effective to meet the needs for the Canadian aging population. Now for a limitation, first will be politics. Healthcare is influenced by politics and stakeholders. They can be influenced by greedy decisions when administering the healthcare system. This has led to cutbacks such as shortage of nurses and increased privatization. The main interest is to create profits. Second is the lack of programs that promote healthy aging, influenced by the cutback on elderly programs, including home care services. Third is the nurse lack of power. Since World War II, nurses have tried to have the same privilege and prestige as physicians in the healthcare profession. However, until this day, nurses lack recognition compared to physicians because historically, doctors have been viewed in a higher position in the healthcare. They have more authority due to their profession and their gender, whereas historically, nurses were female and considered to have no power. The fourth limitation will be healthcare system. Currently, the healthcare system funding goes towards acute care. Since 1990, the healthcare system has cut back on the healthcare funding towards long-term care, including a decrease in number of staff, hiring untrained workers with this population. Therefore, this is affecting the elderly population when providing them with healthy aging services. Fifth limitation would be ageism. Negative perception towards the elders. They are seen as disabled, dependent, and declining. And the last, media. Media influence society to have a negative perception about the elderly. This has socially constructed how physicians and nurses treat the elderly population because media portrays them as being weak, useless, and dependent. So, how do this issue impact how nurses maintain and develop therapeutic and professional relationships? This causes burnout, which affects their ability to provide holistic care. In the following slide, you can see there's a quote, and I would like you guys to read it because it reflects how nurses speak about burnout. Since we have a shortage of nurses, it has caused them to have higher stress, which has led for them to have medical errors of documentation, errors of medication, and distancing from the patient. The main issue is the manner in which the government is managing the healthcare system. The focus tends to be more on the curing rather than promoting healthy aging. The shift in focus is essential because by 2031, elderly individuals will make up 25% of the Ontario population. Although nurses have many organizations such as CNO, RNAO, and CNA, nurses continue to struggle to establish their voice and power within the healthcare system. There must be an upstream change in order for nurses to gain power to advocate for the elderly and provide the best care. This concludes our presentation. Thank you for listening.